All right, so today we're going to inject some temporal hollows, and temporal hollows are more obvious in thin patients, and it's something that occurs because the temporal fat pads start to decrease in size as we get older, and in thin patients it becomes more obvious, which gives sort of a hollowness to the temple area. So how do we do this? Well, there's a couple of different ways to do it, but we need to know the pertinent anatomy before we start injecting. So key points of the pertinent anatomy are the superior orbital rim, what's called the temporal line, or the where the temporalis muscle actually inserts onto the skull, where it's called the conjoint tendon. And then you have to worry about vessels. So this area is where the superficial temporal artery is, and it's actually the anterior branch of the superficial temporal artery where we can get into trouble, because that actually connects to another artery called the supratrochlear artery, and any intravascular injections that can occur can lead to blindness. So we have to be very careful. So appearance and safety are the two things we need to be worried about. So how do we keep it safe? Basically what we do is we go from the superior orbital rim, just where the temporal crest is. If you go about 1.8 centimeters superiorly, and then over another 1.8 centimeters, this is a very avascular area. This is a safe place to inject. And so how do you inject? Well, there's a debate. Do you use a cannula? Do you use a needle? Well, the answer is both, but it depends on which technique you use to inject. I prefer to use a needle, so my injection has to be deep to the muscle and down towards the bone, where it's an avascular plane. If you were injecting subcutaneously or superficially, then you would use a cannula, 25 gauge or larger, to prevent any inadvertent injections into the vessels. So what we're gonna do is we're gonna go through the area that I've already marked and straight down through the muscle, through any potential vessels, and we're gonna inject it to inflate the temporal region. The other thing to do is you have to hold your finger back here so that the filler doesn't migrate posteriorly, because this tendon here is actually very tight and you want it to stay in this area right here. So what kind of fillers can you use in this area? I use a high G prime filler because I go deep, and that's something like Voluma. And I like that because it fills it up in a sort of a circumferential pattern and then brings it out symmetrically. So we're gonna get started. And the key is you want to leave a tiny bit of concavity. If you make it convex, it looks abnormal. So you don't do that.
Right.
Exactly. Great. You let me know.
Thank you. It looks better.
Yeah, I don't think
It's subtle, but
Yep.
you would not want it to be.
No, I think
More
that's
than
plenty.
that.
Yep.
Thank you.
Yup.